microbiological profile and visual outcome in post-operative endophthalmitis in tertiary care hospital in Northern India. So infectious endophthalmitis following cataract surgery still is a devastating condition. Despite major improvement in surgical technique in the last decade, most series report on an incidence rate ranging from 0.05 to 0.4% in different studies worldwide. Most cases are caused by microorganisms from the conjunctiva and the eyelid. They might be secondary to surgery or to trauma. So this is a retrospective study of post-operative endophthalmitis from August 2023 to March 2024 in 100 patients in a tertiary hospital of Northern India. So any patient developing endophthalmitis within 1 year of any intraocular procedure was included in the study. According to the severity, treatment with a trial of intravitreal antibiotic injection or port vitrectomy was performed. Ocular samples were collected, which were either anterior chamber tap or vitreous biopsy and sent for the microbiological examination. The samples were stained with gram and KOH stain and cultured on chocolate agar, lead agar, brain heart infusion broth and seborrheic dextrose agar. The following information was assessed: the number of presumed and culture positive in the endophthalmitis cases, the source of infection, the microbiological results. So the exclusion criteria were: any patient developing endophthalmitis after 6 months of any other intraocular procedure, patient having pre-existing posterior segment pathologies, patient having systemic disorder like uncontrolled diabetes mellitus. The results were as follows: vision after 4 months, 6/60 was found in 35 patients, 6/36 was recorded in 48 number of patients, 6/24 in 12, finger count in 3 and hand movement was present in 2 patients. The microbial distribution was as follows: the most common microorganism in our study was Micrococcus, which was found in 45 number of patients, Staphylococcus aureus in 32, Staph saprophyticus in 8, Staph epidermidis in 1, Streptococcus 2, Citrobacter 2, and no organism was found positive in 5, and KOH mount was positive in 5 patients. The organism distribution is as follows. So this picture shows the patient on whom early vitrectomy was done showed better visual outcome, as it can be seen in pre-op picture 1 and 2. The patient in whom late vitrectomy was done showed lesser visual recovery after vitrectomy. The pictures as shown here are the organism found was organism Staph saprophyticus. This is the second picture is after 4 months of the surgery, after both vitrectomy and intravitreal. These are the pre-op and post-op. And poor prognosis was found in patients in whom corneal involvement was also present. So discussion as expected, most cases were secondary to a surgical procedure, that is 62% or trauma 12%. The microorganism profile in the post-operative and post-traumatic group is that present in the conjunctival flora in both and from the environment in the latter. In previous study, Staphylococcus aureus was the most common organism found, in contrary to our study in which Micrococcus was found. The limitations are time frame of the study, antibiotic susceptibility can also be assessed, and more counseling should be done in the patient who were lost to follow-up. Conclusion: aggressive treatment should be done even if we suspect reaction, and the case should be approached as it is of endophthalmitis. Early vitrectomy and intravitreal injection within 3 days from the diagnosis was the sole positive predictive factor for improved visual acuity, showing its advantages over delayed vitrectomy. Thank you.
So I just noticed that none of your patients had a visual acuity of better than 6/60. Is that correct? So what do you think was the reason? Were they taken up late for vitrectomy? Because generally, if we've done an early vitrectomy, we sometimes get...
Patients were taken late for the vitrectomy because as a tertiary care hospital, most of the patients that we get are mainly referred from other hospitals, and they are very low socioeconomic status patients. So when they appear to us, they come 15 to 20 days later.
Okay. And you did not talk about the KOH mounts that, since it was a microbiological profile you were studying, did you also study the type of fungus? That would also have been worthwhile.
KOH mount was found positive in 5.
No, which fungus? Aspergillus or Candida? So you could have mentioned that as well. That would also have been very relevant to the study.